Hi there. If you or a loved one is over 65, I want you to pay close attention for the next few minutes, because what I'm about to share could dramatically change how you feel every single day, from your energy levels to your digestion to even your memory health. Let me ask you a simple question. Do you enjoy eating nuts as a healthy snack? Maybe a handful of peanuts while watching TV, or some almonds in your morning oatmeal? Well, here's the shocking part. Some of the most popular nuts, yes, even the ones that seem healthy, can actually be harmful for older adults. And on the flip side, there are 4 types of nuts that can do wonders for your brain, your heart, and even help protect against age-related diseases. But don't worry, this video isn't about banning foods or being overly strict. I'm here to guide you like I would with one of my own patients. I'll break it all down in simple terms. What to eat, what to avoid, and why it matters more than ever after age 65. So grab a pen and paper, or just relax and listen. Because by the end of this video, you'll feel much more confident about making smart, delicious, and health-boosting choices. Ready? Let's dive in. Now, you might be wondering, why are nuts suddenly such a big deal for people over 65? Well, here's the truth that most people, and even many doctors, don't talk about enough. As we get older, our bodies change. The way we digest food, absorb nutrients, process fats, and respond to inflammation is very different at 65 than it was at 35. And while nuts are often considered superfoods, not all nuts are created equal, especially for seniors. Let's break it down. First, our metabolism slows with age. That means our bodies burn fewer calories even if we stay active. So foods that are calorie-dense, like certain nuts, can quickly lead to unwanted weight gain if we're not careful. Second, aging often brings more sensitive digestion. Some nuts contain compounds like phytic acid or lectins that can irritate the gut, trigger bloating, or even block nutrient absorption. That's the last thing we want when nutrient needs are higher than ever. Third, and this is critical, many nuts are roasted in unhealthy oils or loaded with sodium, which can quietly spike blood pressure and strain the heart over time. And finally, let's talk about inflammation. Certain nuts, especially those high in omega-6 fatty acids, can fuel chronic inflammation in the body. That might show up as joint pain, memory issues, fatigue, or contribute to bigger problems like heart disease and even Alzheimer's. So while nuts can absolutely be a part of a healthy senior diet, we need to choose them wisely. Think of it like this. The right nuts can be your allies in aging gracefully. The wrong ones, silent troublemakers. In the next sections, I'll show you exactly which 4 nuts to avoid and why. Then we'll get to the fun part. The 4 powerhouse nuts that truly support a longer, sharper, more energized life after 60. All right, now this is the part where many people are surprised. These are the 4 types of nuts I recommend that most people over 65 either completely avoid or eat only in very limited amounts. And I'll explain exactly why each one can be problematic. Let's start with the biggest offender. 1. Peanuts, especially salted or roasted in oil. Peanuts are one of the most common nuts in the world, although technically they're legumes, not true tree nuts. But here's the issue. Most commercial peanuts are roasted in highly inflammatory vegetable oils like soybean or canola oil. These oils are loaded with omega-6 fatty acids, which can cause chronic inflammation over time, something that's strongly linked to heart disease, arthritis, and even dementia. Peanuts are also often high in sodium, especially if they're salted. And let's not forget, they're one of the top allergens and can be contaminated with aflatoxins, a mold toxin that may raise the risk of liver problems and cancer. So if you're reaching for that peanut butter jar every day, it's time to reconsider. 2. Cashews. Cashews taste creamy and delicious, but for seniors, they can quietly cause trouble. Cashews are high in oxalates, natural compounds that can increase the risk of kidney stones, especially if your kidney function isn't as strong as it used to be. They're also relatively high in carbs compared to other nuts, which can spike blood sugar in those with pre-diabetes or type 2 diabetes, something that becomes more common after 65. And if you've ever felt gassy or bloated after eating cashews, that's not your imagination. Cashews contain certain fermentable sugars that can trigger digestive discomfort. Tasty? Yes, but for seniors the trade-off often isn't worth it. 3. Macadamia nuts, when coated or flavored. Now don't get me wrong, plain macadamias can be fine in small amounts. But many of the macadamia nuts sold in stores are coated with sugar, chocolate, honey glaze, or salted caramel flavoring. These additions turn a healthy fat source into a blood sugar bomb, spiking insulin, promoting fat storage, and even raising your risk of cognitive decline over time. Plus, many flavored nuts contain preservatives and artificial chemicals that are harsh on the liver and kidneys, organs that are already doing a lot more work as we age. So if you love macadamias, go raw and unsalted, or skip them altogether. 4. Pecans, when candied or in pies. Plain raw pecans have some health benefits, but the way we usually eat them? Not so great. Think of pecan pie, candied pecans, or sugar-coated holiday mixes. These treats are loaded with refined sugar and syrups, which can wreak havoc on your metabolism. After 65, our insulin sensitivity drops, meaning sugar stays in the bloodstream longer. Over time, that leads to weight gain, fatigue, and increased risk for type 2 diabetes and Alzheimer's disease. Even just a few of these sweetened nuts can send blood sugar levels soaring. So enjoy the memory of Grandma's pecan pie, but don't make it a daily habit. Summary recap. Let's quickly review the 4 nuts to avoid or minimize after age 65. Peanuts, especially salted or roasted in oil. Cashews, high in oxalates and carbs. Macadamias, when flavored or coated. Candied pecans, sugar overload. But don't worry, next I'll show you the 4 amazing nuts that can do the exact opposite. Reduce inflammation, protect the brain, and support heart health. These are the anti-aging superstars, and I think you'll be pleasantly surprised. Okay, now for the good news. And I really mean good news. Just like some nuts can quietly harm your health as you age, there are other nuts that act like tiny shields for your body. They fight inflammation, protect your brain, support your heart, and keep your energy levels up. And no, you don't have to eat handfuls every day. Just a small portion, 5 to 10 nuts, can make a real difference if you're over 65. Let's walk through the 4 healthiest nuts seniors should eat regularly. You'll love number 3. It's a bit of a secret weapon. 1. Walnuts, the brain's best friend. Walnuts are often called the brain nut, and that's not just because they look like tiny brains, although they do. They're packed with alpha-linolenic acid, ALA, a plant-based omega-3 fatty acid that helps reduce brain inflammation. This is crucial for preventing cognitive decline, memory loss, and even early dementia. Studies from Harvard and UCLA show that people who eat walnuts regularly have better brain performance and slower mental aging. Plus, walnuts support heart health and help lower bad LDL cholesterol, a big win for anyone over 65. Tip: soak walnuts overnight to make them easier to digest and even more nutritious. 2. Almonds. Your natural multivitamin almonds are like nature's multivitamin in a shell. They're rich in vitamin E, which protects brain cells and skin from aging. Just a handful gives you over 30% of your daily E needs. They also provide magnesium, fiber, and protein, all essential for stable blood sugar, muscle function, and bone health. What I love most about almonds? They help prevent age-related weight gain by keeping you full longer, thanks to their high fiber and healthy fat content. Just make sure they're raw or dry roasted, not salted or sugar-coated. 3. Brazil nuts, the thyroid guardian. This one's a bit of a hidden gem. Brazil nuts are extremely rich in selenium, a mineral many older adults are unknowingly deficient in. Selenium is essential for thyroid function, which regulates your energy, weight, mood, and even memory. Just 1 or 2 Brazil nuts a day gives you all the selenium you need, without needing a supplement. And there's more. Selenium helps reduce the risk of cancer, especially prostate, lung, and colorectal cancers, all of which become more common after 65. But don't overdo it. Just 2 per day is plenty. More isn't better in this case. 4. Pistachios, the heart helper. Pistachios are small, but they're one of the most heart-protective nuts out there. They're rich in L-arginine, which helps keep your blood vessels relaxed and open, lowering your risk of high blood pressure and stroke. Pistachios also contain resveratrol, the same antioxidant found in red wine, which protects your arteries and supports healthy circulation to the brain. And here's something amazing. Eating pistachios has been shown to lower blood sugar after meals, making them a great snack for seniors with type 2 diabetes or metabolic syndrome. Choose the unsalted in-shell kind for the best benefits and built-in portion control. Quick recap. The 4. Doctor-approved. Nuts for seniors, walnuts. Supports memory, brain health, and reduces inflammation. Almonds. Packed with vitamin E, fiber, and protein for strength and skin. Brazil nuts. Boosts thyroid and immune function, 1-2 per day only. Pistachios. Protects heart, lowers blood sugar, and aids circulation. Dr. Emily nods thoughtfully. So while you should steer clear of a few high-risk nuts like peanuts and cashews, these 4 can absolutely be a part of your daily routine, even if it's just a small snack after lunch or a few sprinkled into your oatmeal. I've seen patients regain energy, improve mental clarity, and even reduce joint pain just by choosing the right kinds of nuts for their age. It's a tiny habit with big results. Before you go swapping out your snacks for a handful of nuts, let's talk about the part many people miss. How to eat nuts safely, especially after age 65. Yes, even healthy foods like walnuts and almonds can cause trouble if you eat them the wrong way. So let me walk you through how to make the most of these superfoods, safely, smartly, and in a way your body will thank you for. 1. Portion size matters. More isn't better. Nuts are packed with nutrients, but they're also very calorie-dense. That means eating a lot, even of the good ones, can lead to unwanted weight gain, bloating, or digestive upset. For most older adults, the ideal serving is 5-7 almonds, 1-2 Brazil nuts, a small handful of walnuts or pistachios, about 1/4 cup. More than that? You might overload your body with oils, fiber, and calories. And it could even cause selenium toxicity with Brazil nuts. 2. When you eat nuts is just as important. Timing matters. Try eating nuts as a mid-morning or mid-afternoon snack sprinkled on oatmeal or yogurt, added to a salad or smoothie. Avoid eating them right before bed, especially if you have reflux, indigestion, or gallbladder issues. 3. Soaking nuts, a secret for easier digestion. As we age, our digestive enzymes decline, and raw nuts can sometimes be hard to break down. Soaking nuts for 6 to 8 hours in water can reduce compounds called phytates, which block nutrient absorption. It also makes nuts softer, gentler on the stomach, and easier to chew if you have dentures or sensitive teeth. Try it with almonds and walnuts in particular. 4. Watch for allergies or reactions. You may not have been allergic to nuts your whole life, but that can change as you age. If you experience a tight throat, itchy lips or tongue, upset stomach or diarrhea after eating nuts, please stop immediately and talk to your doctor. Also, certain nuts, especially peanuts and pistachios, can carry mold toxins if improperly stored. Buy from trusted sources, store in cool places, and check for any bitterness or odd smells. 5. Mix, rotate, and balance. Don't just eat the same nut every day. Mix it up. A good weekly routine might look like this. Monday, Wednesday. Friday, almonds plus walnuts. Tuesday, Thursday, pistachios. Weekends, 1-2. Brazil nuts. This keeps your nutrient profile balanced and reduces the chance of overdoing any one mineral. Here's what I tell my patients, especially those in their 60s, 70s, even 80s. You don't need extreme diets. You don't need to cut out joy. You just need the right tiny daily choices, like swapping out sugary snacks for 5 almonds or 2 Brazil nuts. These tiny habits build a brain that stays sharp, a heart that stays strong, and joints that don't ache with every step. I've seen it change lives. If you found this helpful, I'd love for you to do 3 things. 1, hit the like button. It helps this video reach other seniors and families who need it. 2, subscribe if you want more simple, trustworthy health advice every week. 3, and in the comments tell me, what's your favorite nut? Or what's one change you'll make starting today? I'll be down there reading and replying.